This is Doug Brunk for Global Medical News Network, reporting from the annual meeting of the American Society for Laser Medicine and Surgery in Phoenix, Arizona. During a press briefing, Dr. Matthew Avram discussed how laser technology is being used for the non-invasive removal of fat.
There is an emerging science and an emerging clinical ability to non-invasively remove fat. In other words, you can remove fat from someone without cutting into their skin. And with some of these devices, you don't need anesthesia, you don't need topical anesthesia, you don't need injections. It can just be done with a minimal amount of downtime. At this point, these traditional procedure, of course, is liposuction, and the devices that are emerging now don't compare in terms of the amount of fat removal you're going to get with liposuction. However, the convenience and the relative safety at this time, I think, are part of an important emerging trend that I think is going to be a big story over the next few years. So there are a lot of talks devoted to that, and this is something that's being hit kind of by ground, air, sea. I mean, so there's radio frequency, there's ultrasound, there's laser, and one thing that is very interesting is actually the application of cooling. And this is something that Dr. Anderson developed, a concept that actually the fat cells in your body, especially right beneath the skin, are more cold sensitive than the surrounding skin. So in other words, fat are more susceptible to cold. So that is being manipulated, that science, to affect non-invasive fat removal. It's a process called cryolipolysis. So the fat realm, I think, is one that is becoming exciting. I want to make a distinction. There's also laser lipolysis, and that's not quite the same thing. Laser lipolysis, or laser liposuction, I don't know how you may have heard the term, but that's something where laser is actually still, there is an invasion, the laser goes into the skin, it kind of heats the fat, melts the fat, and then you kind of suck it out afterwards. That's not quite the same thing, but that's another thing that's being discussed at the conference as well.
For Global Medical News Network, this is Doug Brunk.